Well, hello, one and all. Welcome to Healing Outside the Box. My name is Jean Tiberio, and I'm a nutritionist and a wellness coach. Today I bring you episode 222, Understanding Acid Reflux or GERD. I love saying the name GERD. It sounds pretty much like it represents a regurgitation of what's in your stomach. And I'll get to all those lovely images in a minute. But first, I want to tell you about where you can find me. My website is called Healing Outside the Box, and I have a contact page where you can simply write whatever nice things that come to mind. I also have a new texting system called Talk, which is TAWK. If you're on my website on any page, just click on the green envelope and you can reach me via text. This podcast is now found pretty much wherever you find your podcasts, whether you're on Apple or Android. Google now has a place called Google Podcasts, and of course iTunes is now called Apple Podcasts, and you can find me there as well. You can also find me very soon on Pandora. Now, gastroesophageal reflux disease, or GERD, is a digestive disorder that affects the ring of muscle between your esophagus, or food pipe, and your stomach. This ring of muscle is called the esophageal sphincter. Many people, including pregnant women, suffer from heartburn or acid indigestion caused by GERD. Some people estimate that about 60 million Americans suffer from occasional reflux symptoms like heartburn at least once per month, and at least 15 million Americans complain of heartburn on a daily basis. And now overweight children are experiencing heartburn as well. Now there's a lot of information on GERD all over the internet, but I'm getting my symptom list from WebMD, and I'll give you the link to it in the show notes. So what are the symptoms of GERD? GERD stands for, as I've said, gastroesophageal reflux disease, and that's basically what happens. The contents of your stomach are coming up the pipe or esophagus. This creates a burning sensation that we refer to as heartburn. Now, this sphincter between your food pipe and stomach opens up to allow food to pass and then closes to keep the contents of the stomach from rising up. Problems occur when the sphincter doesn't function properly. I love saying the word sphincter. Anyway, this GERD is a chronic disease that occurs when either stomach acid or bile or just food contents flow up the food pipe and irritate the lining of your esophagus. You have GERD basically if you get these acid reflux symptoms more than twice a week. Now, the most common symptom of GERD is, of course, heartburn. Now, in case you're one of the few who haven't felt these symptoms, it feels like a burning in the chest behind the breastbone, and it can move up to the neck and throat. This burning can last up to 2 hours and is made worse by lying down. Now, sometimes heartburn pain can be confused with pain from heart disease or angina, but there's a major difference. If you have chest pain associated with heart disease, it will be made worse by exercising or even moving around. If you have any question at all, please see your doctor. There was one case I know of where this middle-aged gentleman died from a heart attack. People said that he never complained of chest pain, but when they emptied out his office, they found huge bottles of antacids. And basically that's what sometimes happens. People, and in particular men, self-diagnose and they start taking antacids for what they think is heartburn, but what is actually angina. So again, if there's any question, please let your doctor know. Now, heartburn is a common symptom of acid reflux, as we know, and occasional heartburn isn't a cause for concern. Many people get heartburn when they take pills, and metformin, taken for diabetes, is one of those pills. But if you get heartburn more than twice a week, you might have GERD. Now, GERD may not normally be more than very irritating, but a chronic type of acid reflux that gets worse can cause complications. Reflux disease may be related to a hiatal hernia in this way. A hiatal hernia occurs when the top part of the stomach bulges up into the chest cavity, and sometimes this happens through a very small opening in the diaphragm. Some people with a hiatal hernia may not suffer from heartburn, but many others may have severe heartburn symptoms. Some doctors now feel that a hiatal hernia may weaken that sphincter, so one can cause the other. Dietary and lifestyle factors can contribute to GERD, as I bet we are well aware. Eating fried or fatty foods, especially at night, can often be the culprit. Alcohol in coffee can also contribute. Eating late at night, eating while lying down, eating chocolate in bed, etc. Obesity also contributes to the symptoms, especially weight that is carried higher up in the stomach, which will put pressure on that sphincter. For the same reason, pregnancy can result in GERD symptoms. Smoking is a major risk factor as well. Cigarette smoking is thought to weaken that sphincter. In addition to losing weight, just generally decreasing the size of your portions at mealtime may also help control the symptoms. And of course, not eating anything within 2 hours of bedtime. This will allow time for the acid in the stomach to decrease and for the stomach to at least partially empty before lying down. And here's a general rundown of different foods and beverages that can weaken that sphincter. They are high-fat foods, your basic pepperoni pizza loaded with items that irritate the lining of your esophagus and stomach, spicy foods, any kind of pepper, yes, even black pepper, will irritate the lining of your esophagus. That pepperoni in the pepperoni pizza has pepper, as does the sauce. Chocolate can be a factor. Citrus fruits as well as pineapple. You may want to avoid these if you already have an irritated lining to your esophagus. But if you don't have symptoms, you don't have to. Ditto for tomatoes. Onion and garlic might be stomach irritants. Again, not so much if you don't already have symptoms. They say mint is an irritant, especially peppermint, so no candy canes. Alcohol is a big one. Coffee is another beverage that can irritate the lining, and to a lesser extent, tea and soda. Again, each person has an individual tolerance level. You don't necessarily have to avoid these foods unless they cause symptoms. So let's recap some of these dietary and lifestyle changes. They are: quit smoking. That's number 1. If you can't quit, it will help to reduce the number of cigarettes. Number 2, lose excess weight, especially cutting down on fried foods. Also, eat smaller meals and don't eat within 2 hours of bedtime. Now, WebMD is telling us to chew gum after eating, but once again, not peppermint gum. I think they meant to say that. Avoid lying down after eating. That's a big one. Avoid wearing tight clothing. Here comes another big one. Practice relaxation techniques. And finally, some herbal remedies might also provide relief. And these include something like chamomile tea. It certainly can't hurt to give it a try. You can elevate your bed at night if you have an electric bed. If you do not have an electric bed, a specially designed wedge can help alleviate some of your heartburn symptoms. They don't recommend that you use pillows to prop yourself up. That may only increase pressure on your stomach. Now, if some of these diet and lifestyle changes aren't helping, your doctor can recommend over-the-counter or prescription treatments. Antacids like Tums can help neutralize the acid and relieve that heartburn. However, long-term use of antacids can result in some side effects, including diarrhea, altered calcium metabolism, and a buildup of magnesium in the body. If you have kidney disease or even altered kidney labs, talk to your doctor because too much magnesium might be a very bad thing. And if you're popping a lot of antacids, you should probably consult with your doctor. Now, your doctor may prescribe medications to reduce the acid in your stomach. There are 2 basic types of meds. They are H2 blockers, which inhibit acid secretion in the stomach. These H2 blockers include Tagamet, Pepcid, and Zantac. Another type of drug is called the proton pump inhibitor. These inhibit an enzyme or protein in the acid-producing cells of your stomach. These cells are necessary for acid secretion, so they stop the secretion. Some of these proton pump inhibitors include Nexium, Prevacid, and Prilosec. Now, you may want to let your doctor know if these symptoms are severe and persist. Your doctor may want to perform something called an endoscopy. This involves putting a scope with a little camera attached down your esophagus. Your doctor will then be able to see if there is inflammation of the lining to your esophagus. Here is my opinion on this testing. It's very important to see your doctor to make sure that the pain you're feeling is not from another cause, such as heart disease. For that reason alone, I think it's crucial that you see a doctor. However, if your doctor knows that it is reflux disease, doing an endoscopy may cause more discomfort than it's worth. Your doctor knows that you may have reflux disease if the antacids make it better, and lying down or eating a pepperoni pizza and then lying down make it worse. I personally would recommend taking another go at the diet and lifestyle remedies. Now, are there complications of long-term GERD? Occasionally, GERD symptoms can result in complications. Something called esophagitis can occur as a result of too much stomach acid in the esophagus. This esophagitis could cause esophageal bleeding or even ulcers. In addition, you may get a narrowing of the opening to your food pipe as a result of chronic scarring. And if this happens, people can develop a condition known as Barrett's esophagus. This is no good. It could possibly increase the risk of getting esophageal cancer. Let's go over a few things that are related to GERD. The first is anxiety and GERD. According to a 2015 paper, anxiety might be making some of the symptoms worse. If you think that anxiety is making your symptoms worse, you may want to talk to your doctor about it. If you don't want to go on pills for the anxiety, you could try a number of relaxation techniques that can work for you. Some of the things that you could do to reduce anxiety include, this seems obvious, but let's say it anyway, limit your exposure to experiences, people, and places that make you feel anxious. I know, easier said than done. It might be helpful to try something like meditation or deep breathing exercises before heading into what you know to be an anxiety-producing situation, such as going to your dentist. In my last episode, which was 221, I devoted the entire episode to getting enough sleep, and I can give you a link to that in the show notes. You could also try an exercise routine. It could be walking. It doesn't have to be jogging or weightlifting. Or you could try listening to music or get one of those waterfall apps with relaxing sounds. As I like to say, whatever rows your boat, basically. Now, if your doctor suspects you have an anxiety disorder, he or she may refer you to a mental health specialist for diagnosis and treatment. And the treatment, as you know, can include medication, talk therapy, or any combination of both. But the bottom line is less stress, less symptoms. Okay, pregnancy and GERD. Pregnancy can and usually increases your chances of experiencing this acid reflux. If you had GERD before you got pregnant, your symptoms may get worse. I don't think that would surprise anyone who's had kids. Now, there's also hormonal changes during pregnancy that can cause the muscle between your esophagus and stomach to relax more frequently. And of course, a growing fetus, i.e. basketball in your stomach, can put pressure on your stomach and push up the food and acid into your esophagus. That seems altogether too obvious, but if you want to attack the problem head on, going over eating tips to avoid heartburn during pregnancy can be started during the first trimester. Now, some meds that are used to treat acid reflux are safe to take during pregnancy. Many years ago, I worked as a dietitian at a community health center. Many of my patients were pregnant, and I seem to remember Tums or similar antacid working for them. Whether you tackle this with food or antacids, always check with your doctor first. Okay, asthma and GERD. It's been reported that more than 75% of people with asthma also experience GERD. It may work in both directions. In other words, GERD might make your symptoms of asthma worse, but an asthma attack might raise your risk of experiencing acid reflux. Then there's irritable bowel syndrome and GERD. Now, IBS or irritable bowel syndrome is a condition that affects your large intestines. Common symptoms include abdominal pain, bloating, and either constipation or diarrhea. If you have IBS, you are more likely to also have GERD. If you have symptoms of both IBS and GERD, you should probably talk to your doctor about what to do. But all of the food-related suggestions apply here. Now, alcohol and GERD. We mentioned this earlier, but it's worth mentioning again. Some people have no trouble drinking alcohol in moderation, but for some people, even small amounts of alcohol will trigger their symptoms. If you combine alcohol with fruit juices or other mixers, those mixers can increase symptoms further. An example might be, say, a mimosa, or as I remember having when I was younger, a Cape Codder, which is vodka with orange juice and cranberry juice. I don't remember heartburn being much of a problem for anyone under 70 or 80 back then, but if it was, a Cape Codder would make it worse. The bottom line here is this. GERD is definitely a condition of Western society, which means that we do have control over the dietary and lifestyle factors that contribute to it. If you have any questions or want to start a conversation about this whole topic, feel free to contact me on my contact page, which is again, healingoutsidethebox.com. That's all I have for you today. Be well and stay tuned next week for another episode of Healing Outside the Box.